Today we'll talk about the bubonic plague. We'll give a short introduction to its causing pathogen, where still cases occur, and the consequences it has on the infected body. Finally, we'll have a glimpse of the possible treatments. As always, this is for education purposes only and in no way meant as a medical advice or a substitute for an appointment with your doctor. Let's start with the causing pathogen, Yersinia pestis. It is a gram-negative, pleomorphic, facultatively anaerobic bacteria without any spores or flagellates. What does that mean? First of all, gram-negative means that the bacteria doesn't retain the purple color in the gram staining method due to a thin peptidoglycan wall. We won't go into further detail about the design of this kind of bacteria at this point. I just wanted to raise your awareness that there are some antibiotics that target specifically gram-negative bacteria. Aminoglycosides are such a class of antibiotics that we will introduce later in this video. Pleomorphic means that the bacteria is able to adjust its morphology according to its surroundings. It is also facultatively anaerobic, what means that it can live optionally with or without oxygen. Spores are highly resistant, dormant structures. Dormant means in this context that they don't have any metabolic activity. Spores are formed in response to adverse environmental conditions to help the bacterial organism to survive. They do not have a role in bacterial reproduction. As we've said, Yersinia pestis comes without any spores or flagellates. Flagellates are structures that make movements of bacteria possible. They look something like that. As you can see, they are attached to the bacteria at one side and free, without any attachment on the other. Yersinia pestis produces urea, what makes it distinguishable from other Yersinia bacteria. Yersinia pestis doesn't attack patients on its own. It needs a host. There are basically 5 different animals or groups of animals that can work as hosts. Certainly best known for transmitting bubonic plague are rats. They do not cause the actual infection of the patient and not even the fleas themselves, but they work as a host for Xenopsylla hyopsis, which is the host for Yersinia pestis. So Xenopsylla hyopsis is the flea that lives on a rat, for example. Other animals that can carry Xenopsylla hyopsis around are mice, rodents, prairie dogs, and squirrels. As you know, these animals do still exist, and so do Xenopsylla hyopsis and Yersinia pestis. There are occasional endemic outbreaks of the bubonic plague in parts of Africa, Asia, and also in the United States. As I've said, these outbreaks are endemic, so they don't leave their area of origin, and they are comparably easy to control by strict quarantine measures and the effective use of antibiotics. We've already introduced the path of infection with the bubonic plague. First, Yersinia pestis infects the flea Xenopsylla hyopsis that lives on the host, a rat, mouse, rodent, prairie dog, or squirrel. Once these hosting animals get close to a human, the flea can jump over to the patient and bite him or her. The bacteria gets transmitted by that bite. Once Yersinia pestis is in your body, it will attack your lymph nodes and multiply there. The classic buboes of the bubonic plague evolve in that phase. That means the patient will get swollen lymph nodes with this typical bluish color. Look some photos of those buboes up if you're interested, but be warned, they look a bit disturbing. Moreover, the patient will be confronted with a sudden onset of fever, headaches, myalgias, that means in a nutshell muscle discomfort, such as aching, soreness and pain, and chills. An especially sneaky feature of Yersinia pestis is that it will form a capsule around itself that protects it from phagocytosis, an immune reaction in which it would get basically eaten and destroyed in bodies with a temperature higher than 37 degrees. That means it doesn't just weaken you, it also gets more difficult to destroy the sicker you get. So far, we're talking about the classic symptoms of the bubonic plague, which is the most commonly caused disease when somebody gets infected by the plague-causing bacteria. One possible complication is, apart from those we'll discuss in a minute, meningitis. Meningitis means the inflammation of the protective membranes of the brain, which is most commonly caused by a viral or bacterial infection. This comes along with fever and signs of meningism, such as neck stiffness, headaches, and an altered mental status. The lethality of bubonic plague is, if untreated, 50 to 60%. The bubonic plague, though, may progress to a septicemic plague once Yersinia pestis gets in the bloodstream. The symptoms include all of what we've already discussed for the bubonic plague, with additional sepsis, abdominal pain, a possible shock, and DIC. DIC means disseminated intravascular coagulation. As you can see from these symptoms, you definitely want to stop a progressing bubonic plague as soon as possible. It might even progress further to a pneumonic plague, which is a rapidly progressing pneumonia that has a lethality rate if untreated of practically 100%. Pneumonic plague can be transmitted by infectious droplets of the patient. Therefore, you need to keep everyone with the slightest risk of having pneumonic plague in strict quarantine until the lab has ruled out whether the patient has it or not. As we already know, Yersinia pestis is a bacteria. Therefore, antibiotics are the medication to solve the problem. It depends a bit on the country and regulations which drug is the first-line medication, but in general it's 4-gentamicin or fluoroquinolones. 4-gentamicin is an aminoglycoside that binds to the 30S subunit of the bacterial ribosome. That causes irreversible inhibition of the translation initiation complex. Or, to put it in a nutshell, it makes it impossible to carry out protein synthesis. That causes the death of the bacterial cell. The general effect of aminoglycosides on the mRNA is the cause of misreadings. Depending on the concrete aminoglycoside, it causes either translocation of the initiation complex or causes start codon misreading. We'll get deeper into that in a video that is dedicated to antibiotics. Common second-line medications are tetracycline and doxycycline. The most obvious prophylactic measure is the population control of the animals that host Xenopsila hiopsis. Postmodern society does generally already a pretty good job on that. We don't live together with rats anymore, they don't get close to us while we sleep. Another prophylactic measure we've already discussed is the mere isolation of patients that were possibly exposed to Yersinia pestis and those that were in contact with them. This isolation needs to be obtained for at least 6 days, but that does also depend on the restrictions of the country where it happens. Inactivated vaccinations exist, but don't provide sufficient protection and are just justifiable if there is a proven exposure risk. Thanks for watching. See you next time.